Hope your work week is off to a good start. You're watching Arirang TV's continuing coverage of COVID-19. I'm Min Sun-hee. We're back from a long weekend holiday to mark the Lunar Harvest Festival. And while daily infection numbers remain in the double digits, authorities are on high alert, given past trends of surges in cases following long weekend holidays. We start the program now, as always, with the latest numbers on the pandemic here in Korea and elsewhere around the world with our Kwon So-ah. So now do start us off with the situation here on the local front.
All right, Sunny, for 5 straight days, coronavirus cases were relatively stable in the double digits. So why don't we start with taking a look at our graph now. Except for a one-day surge on Wednesday to the triple digits, cases were mainly between the 60s and the 70s, with 73 reported this Monday. However, that is still a little higher than the figures we had right before the holiday, when the number was even below 50.
I see. So the upcoming week or two will be crucial in assessing whether social distancing measures this past holiday have been effective.
Exactly, and that is due to the incubation period of the virus, and which is also why authorities are still on guard, and they are asking the nation's people for vigilance until the end of this week. In fact, we are still at the 2-week special virus prevention period, and for 2 weeks until Sunday, with most citizens also getting another 3-day break, including Hangul Day on the 10th of this month. Meanwhile, now the country has a total of 24,164 cases. The death toll stands at 422, and 31 new additional people have been quarantined in the past day, with 41 recoveries. And if we take a look at our map now, Gyeonggi province reported the highest number of infections this Monday at 27, followed by 19 in Seoul and 5 in Incheon. And also here are some concerns in the southeastern part of the city, 5 in Busan and 4 in Ulsan. And now let's move over to the international front. Around 265,000 new cases were reported. Now the total stands at almost 35.4 million, and also the fatalities stand at 1,041,800. Now let's take a look at the major outbreaks across the world. Here the U.S. at 7.6 million total infections, including its president. We will have more on that in a bit. Meanwhile, Argentina almost at 800,000, with some 7,000 new cases reported in just a day. More concerns over in Europe. Here in France and the UK, more than 10,000 cases reported on a daily basis. The UK, meanwhile, saw some 23,000 infections on a Sunday, but a technical glitch is being reported to have led to an additional 15,000 cases there. And those are the updates I have for now, but I'll be back with more after the government briefing. Sunny?
All right, so thank you for that. I'll see you in a bit. Staying on the international front, U.S. President Donald Trump and First Lady Melania Trump are being treated for COVID-19 after testing positive last week. Now, for more, I have Stephen Herman, White House Bureau Chief for the VOA, live on the line. Hello, Stephen.
Pleasure to join you.
Now, kind words of goodwill have been extended from world leaders, including President Moon Jae-in and even North Korea's Kim Jong-un, following President Trump's tweet confirming both his and his wife's infection. Now, what appears to be his current health condition?
Well, the doctors are being very optimistic, and the president himself has taken to Twitter, releasing a couple of videos in the past 2 days, also showing the world just what kind of shape he's in, and he's looking and sounding very good. However, there has been some contradictory information that has come out from his team of physicians, speaking to reporters in front of the Walter Reed National Military Medical Center in Bethesda, Maryland. And a lot of doctors on television here and on social media are also commenting that based on the drugs that the president has been administered, they feel his condition is more serious than the doctors are admitting.
I see. Stephen, do we have any official word on how President Trump was infected with COVID-19?
No, there has not been. And the doctors and administration officials have sort of fended off those questions. There is a lot of speculation that this may have taken place a week ago Saturday, when the president hosted an event in the Rose Garden of the White House, which I was also at, when he announced his Supreme Court nominee officially. The reporters in the back, we were all masked, but most of the guests were not, and there was not social distancing at that event. And we now know that about 8 people who attended that event have tested positive for the coronavirus.
I see. And you also tested yourself as well, right?
Yes, I was tested last Wednesday morning, again Thursday night, and I'll be tested again later this morning at the White House because I was on Air Force One with the president last week, and I've tested negative all 3 times and hoping it stays that way.
We hope so too. Stephen, what is the overall atmosphere among journalists there, and what has been disclosed so far about President Trump's future agenda then?
Yes, well, all of his campaigning is on hold. The Vice President, Mike Pence, will be out this week and, of course, has that debate coming up with U.S. Senator Kamala Harris on Wednesday night because they're the number 2 candidates on the respective tickets for the Republican and Democratic parties. So all events, except for what the Vice President is doing, anything involving the president, will be virtual. But we know that President Trump is chomping at the bit. Doctors on Sunday said that the president could be released as soon as today, Monday. It's about 1:06 in the morning here, so I'm not sure what time he might get out, whether it would be in the morning or the evening. A lot of doctors are very skeptical about that, who have been commenting, saying that because of the medications that the president is on, that he really should not be leaving the hospital this soon. And the worst, as even some of his own doctors have admitted, for the president might be some days down the road, as we've seen with other people who have developed the coronavirus.
Right. The U.S. has about a month before Election Day, Stephen. How is the president's diagnosis expected to shape the final weeks of the U.S. presidential race?
Well, this all depends on how quickly he gets out of the hospital and how soon he's able to get back on the campaign trail, assuming that things don't make a turn for the worse. So would he be able to return to campaigning later on this week? Will he be able to show up at the second debate with the former Vice President Joe Biden? Will doctors want the president conducting these sort of outdoor rallies? I was at the last one that he had in Duluth, Minnesota this past Wednesday night, and it only lasted for 45 minutes. The president usually goes an hour 15, an hour 20. It was chilly and windy, and we thought that was the reason that he cut it short. But now it seems to have been the real reason was that he was not feeling well that night and coming down with the coronavirus. So a lot of doctors would not want their patient out doing something like that, perhaps within even weeks of coming out of the hospital.
Stephen, one final question before you go. Late Sunday, President Trump took a short ride past his supporters in an apparent show of good health, perhaps, that is raising some debate, I understand. Could you fill us in on that?
Yeah, it was very surprising. He had announced it on a tweeted video, but by the time the video was out, the president was already in this mini motorcade that passed by these supporters out in front of the Walter Reed National Military Medical Center, cheering him, waving Trump flags and such. And he, of course, wanted to demonstrate that he's not in as bad a shape as some of the commentators on television have been saying. However, this is being criticized by physicians and, according to some media reports, by current and former Secret Service agents as being reckless because he has the coronavirus. He was wearing a cloth mask, and the agents were seen in protective personal equipment sitting in the front seats, but this vehicle that he's in is hermetically sealed against chemical attacks. So it's just really recirculating the air in that environment, and it was felt by a lot of people that he was endangering those Secret Service agents who, the driver and the other agent who were in the front seat right in front of him.
Right, and hopefully that will not be the reality. All right, Stephen, thank you very much for making the time to join us live at this very early hour in the U.S.
My pleasure. Thank you.
Right, back here in Korea, it's a little after 2 in the afternoon and we are poised to join the regular government briefing on COVID-19 here in this part of the world. Authorities have expanded the list of venues where people are obliged to wear face masks or face fines of up to 100,000 won, starting from the 13th of November. Now, aside from public transportation, those partaking in rallies or visiting medical centers and nursing homes, as well as any of the 12 high-risk venues, will be required to adorn face masks. Starting from the 13th of this month, that would be next Tuesday, there will be a grace period of 30 days. The briefing is about to start. We'll come back to you afterwards.
First of all, we have Commissioner Jung Eun-kyung with the briefing.
Let us now begin a regular briefing on the COVID-19 response here in South Korea.
As of October 5th, Monday, we have a total of 64 new local infections and 9 new imported cases. The total caseload now stands at 24,164. Currently, we have 1,856 people in quarantine, and of them 107 are in critical ill conditions, and we had 1 additional fatality, and the accumulated death toll now stands at 422, with the fatality rate standing at 1.75%. I extend my deepest condolences to the deceased and the members of the bereaved family. Here are some updates on our domestic infections by region. In the Seoul Gangbuk-gu district, in relation to the north of Seoul Dream Church, we have additional cases of 3 more people being confirmed. In total, we have 4 cases being confirmed, and 2 of them are the worshippers, and 2 of them were also the family members. And in Yangpyeong-gu, we also have additional cases in relation to construction site. A total of 11 have been confirmed to date. And in Gyeonggi-do province, in Pocheon City, we have the army base. Since we had the first index case, we have 35 more additional cases being confirmed. In total, we have 36 confirmed cases in total. All of them are military personnel. And we are currently conducting a joint investigation with the private, public, and the military sectors. And in relation to an acquaintance meeting in Incheon-gu City, we also have additional cases being confirmed, total of 13 having confirmed to date. And we have confirmed that in relation to a meeting of the relatives of married couples, we have 7 additional cases being confirmed, and 2 of them were from Daejeon, and also 3 of them were from Ulsan. And moving on to our imported cases today, we have 9 new imported cases, that is, and 2 of them have been confirmed at points of entry, while the rest of 7 have been reported while on self-quarantine, and 7 of them were South Korean nationals, with 2 being foreign nationals. We have 2 from Asia and also 2 from the US as well. And looking at the risk factors for the past week, we have identified that the average daily cases have hovered around 54.4, which is about 18 less cases than the previous week. And we have also seen a decrease of cluster infections by 10 to 5. And we also have under 20% that are under investigation. And the percent of new cases under management is under 80%. And as for the imported cases, on average, we have about 16.1 cases of imported cases. And as for the cases of the domestic infections, we have identified to them be about 23.4%, and of 21% were related to the cluster, the former confirmed cases. And we also had many cases in the metropolitan area, as well as Gyeongbuk region, in particular the Pohang city. And as you can see in the press kit, we are seeing multiple venues, including multi-use facilities, including sauna and public bath as well. And we also see educational facilities and door-to-door sales, as well as other venues that are witnessing cluster infections. We also have mental hospitals as well as nursing homes, which are actually prone to higher infection rates, and thus we are very identifying the importance of having a cohort quarantine for these facilities. And we would like to highlight that all of the staff members working at these facilities need to comply with quarantine measures, including wearing a face mask as well. And all of the new inpatients need to be tested, and if they show symptoms, they need to be tested as well. And also they need to have a strict control of visitors, and they also need to have stricter control of the quarantine and ventilation. And centering around these nursing hospitals as well as the hospitals, we will be carrying out intensified testings for new inpatients. And in order to identify and trace the patients at an early pace, we need to identify and test all of those who have symptoms. And it is very important for us to curb the further spread of the virus after the Chuseok holiday. And next, in relation to the multi-syndrome inflammatory disease among the juveniles, we have identified in relation to the COVID-19. Since April, we have seen multiple cases centering around Europe and North America, and we have seen that these children have been infected with the COVID-19, and after several weeks, we have seen this inflammatory syndrome being witnessed in their bodies, and therefore, our agency would like to continue our monitoring for these diseases here in South Korea. And starting from the 28th of May, we are carrying out our monitoring scheme. We have a total of 7 reported cases, and we are carrying out clinical trials and clinical analysis, and we have identified that 2 are under this syndrome, and all of these 2 have showed improvements and have been discharged from the hospitals. The first case is a boy, 11-year-old boy, who have visited the Philippines and also experienced a stomach ache and has been hospitalized and has now been discharged. And we also have been conducting our expert meetings, and we have attested that he did not comply with the COVID-19 conditions. However, we also conducted the antibody testings. However, we have shown that this shows that the boy has been tested positive for the COVID-19, and therefore we have also finalized and confirmed that this boy was under the case of this multi-inflammatory syndrome. And next, we also have the second case, who is also a boy in his teens and also has come into contact with a previously confirmed case of COVID-19, and he has shown symptoms of fever as well as stomach ache. And on 17th of September, he has been reported, and we carried out our experts committee meeting, and we have identified him to be under this case. And compared to other countries like Europe and the US, we have a lower number of the accumulated number of total cases of COVID-19. Therefore, we have a less number of the multi-system inflammatory syndrome among children. However, we will be carrying out our monitoring scheme going forward. In order to prevent such diseases, it is very important that we carry out our quarantine measures going forward.
During
the COVID-19, we have been going through our Chuseok holidays, which is the first large public holiday after the COVID-19 outbreak, and we understand that many people had to experience unprecedented examples of enjoying their holidays for not being able to visit their relatives and hometowns. However, people have complied with the quarantine measures to a large extent. And there were also many medical practitioners who were fighting on the front lines, as well as a lot of the quarantine officials who also exerted their full efforts day and night. And we would like to extend our deepest gratitude to all of them. During the weekend, we maintained a 2-digit number of on-day increase. However, we need to factor in the account the fact of the lower number of conducting of testings during the holiday. And during the holidays, we also continue to witness cluster infections questions centering around nursing hospitals, and we also had the family meetings, infections, and we see that the virus could be spreading through the community as well. And after the Chuseok holiday, now it is a very important time for us to concentrate on tracking down these patients. And after we have a large movement of people, and if you have come into contact with other people, and if you show symptoms, please get tested as soon as possible by visiting a nearby screening clinic and avoid going to work or going to school. And we need to contain the virus going forward, and we need to also ask for you to participate in our quarantine efforts, and we will also exert our full efforts to this end. Thank you very much.
Right, that was Chung Young, the Commissioner of the KDCA, with Monday's afternoon briefing. So, what was the gist of her address today?
Well, as we are back from the 5-day Chuseok holiday, Chung stressed that it is now really important to find any potential new cases of the coronavirus, and especially to detect these symptoms right after this holiday, which comes after the major outbreak we had in the metropolitan region after mid-August. And it looks like in the past week, however, we are seeing a decline in cases, as in the past week, the average of daily cases stood at 57.4, which is down by 18.1 from the week before. So that is good news. The average for imported cases stands at 15.6. Now, the 57 cases I meant were domestic cases. And in the meantime, there are still many cases related to multi-use facilities as well as medical facilities, which is why we still have to be cautious. And she also reported of some cases regarding the multi-system inflammatory syndrome among underage, because there were earlier cases related to that in other countries such as in Europe. And it looks like in Korea there were 7 cases which appear to be related to that syndrome, and that goes for underage who had COVID-19 and later on developed the syndrome. So clinical analysis is underway regarding that.
I see. All right, so thank you for that. I'll see you again tomorrow.
See you tomorrow.
Meanwhile, COVID-19 is fueling creative ways to connect on campus as college students seek to abide by containment efforts while engaging in both scholastic and social pursuits. Do take a look.
Growing concerns over the spread of COVID-19 have forced universities to hold virtual classes for another semester, leaving campuses empty nationwide.
대학교 수업도 중요하지만 이렇게 다양한 활동이나 이런 걸 통해서 다양한 경험을 하는 것이 중요한데, 이제 코로나로 인해서 이런 활동들이 위축되다 보니까 너무 수업 중심적으로 되는 게 아닌가라는 걱정이 되고, 또 여러 가지 문화나 이런 것들이 이어서 전달되지 않는 것도 참 아쉬운 것 같습니다.
So what changes have been brought about to the student body since COVID-19? We visited the office of Seoul National University Student Council to find out more.
갑자기 변경된 비대면 강의 수강 방식이나 아니면 사회적 거리두기가 아직 높은 단계인데 그럼에도 대면 시험을 해야 했던 상황이나 이런 식으로 학우분들의 의견을 빠르게 수렴하고 또 학교에 그걸 전달하는 과정들이 어려웠던 것 같습니다.
There are concerns that the Student Council could be disbanded altogether amid the ongoing COVID-19 outbreak. However, the Student Council is doing its best to stay relevant by adopting new ideas as an independent body.
좀 새로운 방식으로 학우분들의 침묵을 도모하는 동시에 학생들의 의견을 학교에 어떤 식으로 전달하고 표현할 것인가에 대한 논의가 많았던 것 같고요. 예를 들어서 이번에 코로나 시대에 맞춰 중앙집행위원회에서는 카톡으로 방탈출 대회를 연다거나 인스타그램 이벤트를 연다거나 하는 방식으로 새로운 침묵 도모 활동을 기획한 것처럼 앞으로도 여러 가지 아이디어가 나올 수 있지 않을까 기대합니다.
COVID-19 has also put a stop to club activities, one of the highlights of Korea's campus culture.
대면으로 활동을 진행해야 하는 봉사동아리나 공연예술 동아리는 물론이고 비대면으로 활동을 진행할 수 있는 동아리들이라고 할지라도 학생들이 많이 지쳐 있어서 학교 측에 제출해야 하는 활동 증명 서류를 제출하는 데도 어려움이 있다고 하고 있어요.
오늘은 동아리연합회 제14차 운영위원회 안건에 대해서 다뤄보도록 하겠습니다.
Most club activities are now taking place virtually to keep in line with social distancing measures. The cancellation of many long-awaited festivals has also added to the difficulties being faced by the student body. Despite the situation, the club association is continuing to look for new ways to keep students engaged.
저희 동아리연합회에서 진행하는 사업들도 모두 비대면으로 진행하게 되면서 동아리 소개제도 사이트를 통해서 운영이 되었고 또 SNS를 통해서 동아리 공연 영상을 업로드하는 식으로 비대면으로 행사를 대체하게 되었습니다. 정부나 교육부의 방역 지침에 따라서 동아리 활동을 어느 정도로 진행하면 좋을지 계속 공지를 통해 안내해 드릴 예정이고요. 그리고 만약에 대면으로 진행하더라도 계속해서 방역상 안전한 활동을 할 수 있게 계속 지원해 드리는 것이 저희 향후 대책입니다.
Despite the challenging circumstances, the COVID-19 pandemic has done little to deter the passion for learning and excitement among Korea's young students in college.
October 5th marks Korean Day, a day designated by the government here to commemorate the presence of more than 7 million Koreans living overseas. Now, quite a number of them are engaged in humanitarian efforts. And for more on these efforts amid the pandemic, I have Sebastian Kwon, the head of the Korean Australian Medical Society, live on the line. Welcome, Dr. Kwon.
Okay, thank you for having me.
Dr. Kwon, perhaps we can start with a few words about the society that you head.
Yes, the Korean Australian Medical Society, or CAMS, is a not-for-profit charity organisation that's comprised of approximately 150 registered Korean Australian doctors. It was founded back in 2012 with three main objectives of charity, education and collegiality. And we've been focusing on educational seminars and expos, raising awareness of conditions that affect our Korean community the most, and health services that are available. And we try to reach out to those who are socially disadvantaged, including the elderly and those with a language barrier. We also work through various different educational and social meetings and publishing the Korean Medical Directory. We try to work to improve the networking between members and particularly between family practitioners and specialists, which in turn helps to provide better care of our Korean Australian community. Certainly, without a doubt, Korean patients in general love seeing doctors who can speak Korean and are so relieved to be able to explain their symptoms in Korean and listen to advice in Korean as well.
Right. Now, I understand that you set up the COVID-19 Korean Australian Medical Advisory Committee this year as well. Do tell us a bit about this committee.
Yes, the concept was born after a meeting back in February when the coronavirus cases were really hitting us in Australia, between the Korean consulate office in Sydney and the Korean Sydney community. And so we, some of us got together on 1st of March for our first online meeting. And then we met on a weekly basis thereafter. And we worked on trying to raise the, I suppose, the level of awareness and more the scientific basis about the virus and how we could prevent contraction. So at the time, there was a lot of conflicting messages on SNS and online, and especially a lot of confusion between arising from the differences in the situations and also public health measures between Korea and Australia, because a lot of the Koreans in Australia still rely on the Korean news to get their news and health advice as well. And with the Korea leading, I suppose, in the pandemic, experiencing it about 4-6 weeks earlier than in Australia, there was a lot of confusion. And so 7 of us with 2 respiratory specialists with in-hospital experience in dealing with it, and 2 family practitioners and 3 other specialists from the CAMS committee, including myself, got together. And we initially focused on the public health messages of each week, of that week, and tried to explain the reasoning why those messages were important. And then we moved on to publishing newspaper columns with our own personal experiences, dealing with patients in hospital or through our practice settings, and how we also prevented contracting it at home as well, And so then we moved on to various different media interviews. And mid-May, we held an online educational seminar across 2 days aimed at Korean professionals, as well as the general public, which were very well received. And throughout the pandemic, also the committee provided advice to the Korean consulate in Sydney about the COVID testing particularly, and also repatriation of Korean visitors and temporary visa holders back to Korea on a case-by-case basis. But more recently, I think our role has somewhat diminished because everyone's so well educated about the virus as well and how to prevent it anyway. So
I see. Dr. Kwon, speaking within your capacity as a medical expert, what is the COVID-19 situation in Australia like, and how would you assess the country's containment efforts there?
Yes, thank you. And so Australia is at the tail end of the second wave, which is much bigger than the first wave. Unfortunately, most of the cases of the second wave are actually from the state of Victoria, much of which still remains in lockdown. In terms of the public health measures, I think Australia has done remarkably well. And I suppose we are the beneficiary of the great efforts, from South Korea. I think we learnt a lot. So far, we've had just over 27,000 confirmed cases with 893 deaths, which on a per population basis, which is about 4 times higher than in South Korea, but much lower compared to other countries like the UK and the US. I'd say the border closure early on, back in January, end of January and early February, was particularly effective. Given that it's an island country, that was very effective in limited numbers. And effective and quick control of the local outbreaks and contact tracing is effective. But many in Australia would have much criticism of the handling of that aspect in Victoria, which is still currently undergoing investigation as to how that really, they really managed to have, in a way, messed it up, and to say the least. And I would say that out of the failures, I think that's probably the biggest one that's responsible for most of the cases in the second wave and the deaths as well. And one particular criticism has been the use of private security officers to quarantine the overseas returning visitors or travellers, as opposed to the police or the defence force. And still at the moment, Melbourne CBD remains in harsh lockdown, stage 4 lockdown for the last 8 weeks, and is slowly easing into restrictions, easing of the restrictions coming into effect. And so, anyway, so it's been a difficult ride for obviously many people involved, and but there is a sense of, I think, things are slowly getting back to normal, especially outside of Victoria. Certainly, we're hoping for a vaccine very soon.
Right. All right, Dr. Kwon, thank you very much for making the time to join us live at this hour with your thoughts.
Okay, thanks very much for having me.
연휴 기간의 검사량 감소 영향과 연휴 이동량 증가에 따른 감염 확산 시기 등을 고려한다면 이번 주 중반은 되어야 현 상황에 대한 정확한 평가가 가능할 것입니다.
Right, here on the local front, Chuseok has come to an end with daily infection numbers in the double digits. But as authorities point out, we need to wait a week or two to see the actual impact of the Lunar Harvest Festival on our fight against COVID-19. For more, I have Dr. DanHyunkyung Tan from Ms. Medi Women's Hospital joining me virtually today. Welcome, Dr. Dan.
Thank you.
And also, in the spirit of social distancing, I have Professor Lee Hoon-sang from Yonsei University joining us live as well. Hello, Professor Lee.
Hello, thank you.
Dr. Tan, we'll start with you. On the 2 days prior to the start of the holiday, which began on the 30th of September, about 10,000 tests were conducted on a daily basis. And on the 2 days after the start of the Chuseok Holiday, we had 5,000 tests and 6,000 tests respectively. So the double digits we've been seeing in the past few days may be a result of fewer tests in general. With this in mind, Dr. Tan, what are your thoughts on the current COVID-19 situation here in Korea?
Well, the numbers, when we interpret them, we have to take a lot of factors into account. So first of all, it's been 7 weeks since the onset of our most recent wave, and that started August 13th. And so if we look historically, it has taken about 2 to 3 months for us to get down to a baseline level of lower COVID-19 activity in our community. And so this timeline fits with what we would see naturally in terms of decreased activity. However, we do need to take into account, as has been said, that the testing tends to go down over the weekends, over the holidays, and there can be a lag time for when results are uploaded. And so this might be an artifact in terms of the number of lower cases. This might be an artifact of decreased testing. Another thing to take into account is that the test positivity, however, for COVID-19 has gone up. We are averaging about 1% in terms of test positivity. However, over the last 5 days, test positivity has been higher than that. That indicates that perhaps we need to do more testing to catch more positive cases. The other concerning number is the number of tests pending. There has been an uptick in those cases. And so once that backlog of pending test results is reported, we may be seeing more cases. My biggest concern, however, is the increase in the number of cases from clusters originating in hospitals and long-term care facilities. For example, back on September 18th, that number over a 2-week period was 62. However, as of yesterday, October 4th, that number over a 2-week period of cases from hospitals and long-term care facilities was 147, more than double. And we know that once the virus enters these types of settings, it tends to spread very quickly. And so we may be, on the brink of seeing many more cases from hospitals and long-term care facilities in the days and weeks to come. And so this background of increased potential for more cases is where we're sitting. And over the next few days, we may be seeing more cases actually from the holidays, from the travel and the gathering. And so everyone does need to be very alert for what might happen.
Right. Professor E, what are your thoughts on the public's adherence to containment efforts during this Chuseok holiday?
I think, relatively, I think they had been adhering to the government policy quite well. And it seems like relatively quite a large number of people actually refrained from visiting their hometown, especially from the Seoul, Gyeonggi and Incheon area during the long Chuseok holiday time. But still, it seems like there had been some level of travel to places like Jeju Island, which is one of the very holiday destinations. And also, to some extent, it seems like there had been some of the visit to the hometown. So because of the situation had been sustained for quite a long time, it seems like there had been a little bit of loosen up of the atmosphere. However, overall, I think the government's social distancing request had been, it seems like it had been followed up quite well.
Dr. Tan, I earlier spoke with a member of the White House press corps with regard to the health of the U.S. President Donald Trump amid his infection. As a medical expert yourself, and based on what you know about President Trump's health, over general health that is, what is your assessment of his current health condition?
Well, in terms of his age and obesity, we know that he is at a higher risk category in terms of developing severe symptoms. due to COVID-19. In fact, the US CDC states that for his age bracket, the risk of death is 90 times greater than that of people in their 20s. So he is at a high severe risk for developing symptoms. However, in terms of his disease severity, I would say that it's a moderate severity in terms of disease. And the reason why I say this is because he has had signs and symptoms of pneumonia. He had a fever, he had fatigue, and also he had 2 episodes of low oxygen levels. One episode required supplemental oxygen even. And the doctors reported that they found what they called kind of a vague expected findings on chest imaging. But my guess as a physician is probably they saw signs of pneumonia. So in terms of his overall condition, I would say he is at moderate severity right now.
Right. Professor Yi, I hear that President Trump, meanwhile, is receiving an unprecedented mix of COVID-19 treatments. Now, first, an experimental combination of 2 monoclonal antibodies. Second, the anti-Ebola drug remdesivir, which is also being administered here in Korea to critically ill patients. And then third, there's the dexamethasone, which was used owing to low oxygen levels. Could you tell us a bit more about the purpose of these drugs, Professor Lee?
So, especially the monoclonal antibody, the Regeneron and the remdesivir are some of the treatments that had shown some of the earlier evidence of the some of the possibility of the treating with some of little bit of successful data for treating the COVID-19 patients. So I think they are using it. But I think overall, because it is the President of the United States, I think they are trying to use as much as of the tools and treatment that are available currently, especially considering his age and also his obvious situations, and also because of his male as well, which is all the high-risk group categories indications. Additionally, I think the use of the dexamethasone especially indicates that there might have been some of the aggravation, especially with the lowering of the oxygen concentrations. As Dr. Dan says, it might indicate that there had been some types of pneumonia situation. So maybe there had been a little bit of the respiratory difficulties. So it seems like they are using a little bit of the aggressive treatment, but I think it's considering that he is the President of the United States, I think with all the high-risk group indications, I think they are doing many of the treatments that are a little bit more aggressive compared to other situations.
Right. Dr. Tan, meanwhile, here in Korea, the weather has gotten colder, and given concerns of the pandemic, there are calls for people not to carelessly dismiss symptoms like coughing or fever and headaches and so forth. What would you recommend as a protocol to follow in dealing with symptoms of the cold or the flu?
Right. So navigating the upcoming cold and flu season this year is going to be very tricky for patients and also for doctors. My advice is this season, if you have symptoms of the cold and flu, including fever, chills, fatigue, muscle ache, a sore throat, a cough, dry cough, and the unusual symptoms of lack of smell, lack of taste, that would indicate COVID-19. In that situation, you really should call 1339. Get advice and get screened, I think, for COVID-19 as the initial move. It's very important. Do not leave home and go to public places. Do not go to work. Do not go to school if you have any of these symptoms, because you may be infectious. And so it's better to get checked out. In terms of from a healthcare provider's perspective, it would be great if we had a point of care rapid testing for both influenza and COVID-19. But I understand that they will be adding COVID-19 to the panel of acute respiratory illness tests that we normally do for people who come into the hospital with influenza-like illness.
I see. Professor Lee, let's end with a few words on public safety precautions following the Lunar Harvest Festival today.
I think for the time being, even though the confirmed case number had been under 100 figure, around two-digit figures, I think for the foreseeable time, I think it is really absolutely necessary to wear the mask in the public space, and also if it is possible to avoid any of the larger gathering as much as possible. And also, I think it is general precautions to avoid any kind of close distance, to keep some level of physical distance in the restaurant and cafe. And also, for some of the working environment where people are very concentrated, I think we really need to change those situations. Another thing that we have to consider is even though the situation is better in Asia and Korea, the situation is still in the a very high situation with in the United States and in the Europe and in India. The situation is getting again increasing with the increased amount of the confirmed cases. So for the time being, I think it is still necessary to keep some level of the public personal hygiene and the basic precautionary measure.
Right. All right, Professor Lee and Dr. Dan, as always, thank you for being with us today.
Thank you.
Right, well, that brings us to the end of Monday's edition of COVID-19. Do join us again tomorrow as we explore, that is, the presence of the virus in our daily lives and its impact on our efforts to ensure a sense of normality. In the meantime, do take care and see you tomorrow.